Hello and welcome to Senior Connections. This is our monthly look at all kinds of programs and activities in Muskegon County relating to older adults and their caregivers. This is a program brought to you by Senior Resources, which is the area agency on aging for Muskegon, Oceana, and Ottawa counties. And we come to you every month to share the plethora of services and programs that are there in the community, talk about some issues and things that you may not know about, and try to help you navigate what can be a rather confusing network of services. So I'm sitting here maskless at the moment, but I have my mask in my hand. We are in month 9 of the COVID-19 pandemic, and I could not be more excited to introduce you to my guest today. Really privileged to have Kathy Moore with us, who is the Director of Public Health, Muskegon County. You have probably seen or heard her on the news, on Positively Muskegon, read her name. She is the guru of all things related to this really challenging year that we've had. Here we are in December, our last month of 2020. I think it'll be the biggest celebration ever when this year is done. So Kathy Moore, welcome. And
Thank
so
you.
We are both, we came masked.
Yes.
We have more than 6 feet distance.
Yes.
It's really important to us that we let you know the importance of wearing the mask.
Absolutely.
Still, but in order to have a clear conversation, we're going to do this. So welcome.
Thank you, Lisa.
It's your first time on the show.
It is my first time, yes.
Now, you have a long history, though, with Senior Resources.
Oh, my.
Tell us a little bit about that.
Okay, for the last 16 years, I have been the appointed county liaison for Senior Resources. So I have served on that board as a liaison to our Muskegon County Board of Commissioners. I have served as treasurer, and I have also served my term as president or chairperson of that board. It ends the end of this month.
Right. So you and I have known each other for a long time.
Yes.
Through that and other things. But tell us a little, real briefly, because then we really want to get into COVID and everything, but tell us about your history and what brought you to public health.
Wow. So
I know you're a numbers lady.
I am
That's
a
the big
numbers.
thing
So
that
my actual education is in finance and accounting. And I've been with the County of Muskegon for 30 years. So I started at wastewater, which is, in a way, a public health facility. Mm-hmm. But I started at wastewater as the accounts person there. That is when they were doing a lot of building and construction. There was, there was a general contractor and a lot being done. So very, very busy with accounting as it relates to our contractor managing the subcontractors and telling me when it was okay to pay. I did that for a couple of years, and then I transferred over to the Muskegon County Airport when they had the old chalet-style airport, and I was the accountant there under Director Terry Grevious.
Okay.
When they transitioned and the board voted and decided to renovate that whole building, and so that was a lot of excitement there. Again, because construction is not my specialty, the county, of course, hired an engineer. We did just a lot. I learned so much actually through them, but I was still behind the scenes working, doing the accounting. We also had, though, that was the same time where the underground storage tanks, the laws around underground storage tanks went into play, and we had to hire contractors, and there was a lot of property that the airport had acquired that may or may not have had underground storage tanks. And so that was another public health component, interesting enough, hiring the vendors and the contractors to monitor the flow of the water, just to assure that no contamination was made due to the underground storage tanks. A few things had to be dug and filled in and things like that, but that was another exciting. And then I moved over I transferred, still a county employee, to public health as first the administrative analyst, then the finance supervisor. I was deputy health officer for 19 years and then appointed as the health officer, public health director in March of 2015.
Okay,
So a
years.
little over 5 years, but 5 years.
Who knew your 5th anniversary
Oh my
was going to be
goodness.
so crazy
Absolutely,
this year?
absolutely. So with that, I have a public health leadership graduate certificate from University of Michigan to help educate me on the public health side of it. So the financial part, I was always responsible for the accreditation. We've gone through 7 cycles of state accreditation, which was new, 19 years ago, but pretty strenuous, but really aligned with my checks and balances. So that was just right
You're
down
a very
my-
detail-oriented person.
Yes.
So, well,
Yes.
wonderful. Well, I didn't know, I mean, I've known you for a while, but I didn't know all of that. I've only known you in your public health
Yes.
realm, I guess.
Yes.
So let's talk a little bit, because I know we're going to get into it, but you, besides being a county employee for a long time, you're also really involved in the community. Right before we came here, you came from one of the many boards you sit on. So talk to me a little bit about that and why that's so important to you, this involvement.
I think it's so important to me because, first of all, the community deserves it. The residents deserve it. And I think it's our responsibility, when we are given opportunities that we also give back to help. I also feel as a minority, not necessarily a Black woman, but just as a African American, that it's really important that we are shown and known to give back to the community, that our names are on the donors list, and that we are saying, yes, our people are important. What these multiple health and human service agencies are doing for the community is very important, and we need to publicly show that we support these organizations and give back our time and treasure.
I love that. So I'm gonna, besides senior resources, you were the president of Muskegon Rotary, or past a couple of years ago, I guess, because it was the year I joined that.
Yes.
United Way, you're on that board, and you had a long history involvement with that. With Muskegon Community College, you're on that board of trustees, and I think you've told me Harbor Hospice, and there's probably another dozen
previous
or so
treasurer, Girl Scouts.
Okay, that's right.
But a lot of the health and human service agencies, I am just amazed at how much work goes into it behind the scenes. Like, a lot of people experience the fundraisers, or if you're a constituent or a client that needs the service, you experience it from that angle. But, to me, especially as an accountant, there is no better way to understanding the depth of an organization than serving on a committee or board. And I just employ anybody who has the time and the resources to please circulate the gift that you've been given back into this community.
Yeah. Well, there's that saying, to whom much is given, much is expected.
Absolutely.
And you and I both believe that strongly, I know. So,
yes.
So let's talk about public health and everything. So you said, as you said, in March was your 5th anniversary as being public health director and
Yes.
the public health officer.
Yes.
Who knew that?
Absolutely.
I mean, it wasn't like everything started in March, but March is when the first
Yes.
shut down.
Absolutely. And when the
constriction.
first actual positive case
Right.
occurred
Right.
in Muskegon County, and our first death occurred in Muskegon
So
County.
talk to us about that. There's no way to be prepared for
Absolutely
something like
not.
this,
So we
right?
do have an emergency preparedness coordinator and receive emergency preparedness funding pass through from the state, a federal funding pass through from the state. So we have practiced and simulated multiple emergency events, community-wide, local public health, regional. We've had a lot of that, but no way by far could we have imagined that we would experience a novel virus that had such a severe and deep impact on residents throughout our whole nation. So we did have H1N1. That was a real live event, and we were able to partner with amazing health and human service organizations to serve as points of distribution and We all collaborated, and that worked out well, but that was on a small scale compared to COVID-19, of course.
It's just been amazing to me to watch how quickly the information changes. So
Yes.
while we're taping this, today is December 16th.
Yes.
This will air multiple times over the next coming weeks, and just be aware that anything we say now is what we're saying at about 2:15
Absolutely.
on December 16th, because in 5 minutes it might
It
change.
could change. And you know, at first, initially, I was really careful and cautious because I am a numbers. I want my facts checked. And I really didn't even want to say specifically this or that, because this is a rapidly evolving, ever-changing situation. This coronavirus, of course, is novel. It's new to us, and there's still so much we don't know. Yet, there's so much we have accomplished. And when I say we, I don't mean me. I mean everybody involved in this, and that's our public health staff. Thank you so much, guys. Our hospital and hospital staff, United Way, senior resources, our entire health and human service agencies here in Muskegon County.
So I'll just tick these off because there's so much more. So we obviously want to reiterate the basics information. You should always wash your hands,
Yes.
20 seconds at least.
Yes.
When you can't do that, hand sanitizer. Wear a mask. I know in my purse, I at any given time have at least 4, if not 5
Yes.
masks. You should wash these masks
Absolutely.
regularly as well.
Yes.
Keep 6 feet of distance as
Yes.
we're doing. Don't touch your face. Those things are very important because this is a virus airborne.
Airborne,
correct?
and it's communicable, and there's just, again, still so much we don't know, but it is easily spread. And the most important thing is that some people experience severe and even fatal symptoms. So we do know that there are individuals who may have a sore throat, a small cough, loss of taste or smell, and they may feel like, well, hey, this coronavirus was not that big of a deal. I think they should consider themselves blessed, because for others it is a long-lasting illness. People are experiencing pain and soreness and symptoms that they've never experienced before. And of course, like my father in June of this year, fatalities. My father died. And
COVID was a factor. in that.
COVID was a contributing factor, yes.
So let's talk a little bit about that, because of course we're senior resources. We're concerned about older adults and their caregivers, and older adults are some of the most vulnerable.
Yes.
Being old doesn't mean you're going to get COVID, just like
Absolutely.
being old doesn't mean you're going to get Alzheimer's.
Right.
But those risk factors that come from living longer
Yes.
make you more susceptible.
Absolutely. So the probability or the risk factor increases, of course, with age, and it also increases with certain underlying health conditions. So, but we have now seen cases of individuals, and even fatalities of individuals who have no known underlying health condition. I can say that they were not under a doctor's care, so it is very possible, but very hard to identify post-mortem.
Right. So what can we do to help with that? What can we do to help protect certainly our most vulnerable populations, but as you said, sometimes we don't know, and it
Right.
just strikes healthy people.
I think the traditional preventive measures or mitigation measures, the mask, the distance, the exceptional hygiene, hand washing, but intentional, deliberate, staying in small circles. Keep your social circles small, so that if you do end up with the virus, we are able to contact those close contact individuals. Also, vice versa, if one of your friends, family, or coworkers, as long as that circle is small, it does help us to identify close contacts and do the contact tracing notifications.
Reduce that spread
Yes.
that happens out
Yes.
there. So let's talk about vaccines.
Yes.
This has been an exciting week in Michigan.
It has.
Because the vaccine left Pfizer.
Yes.
And Pfizer, of course, is a Michigan headquartered company.
Yes.
We know there's another one, and we're not promoting one over the other,
Right.
but it's getting out there. Let's talk about what that impact is in Muskegon.
So the impact in Muskegon, first of all, Michigan-wide, so proud to have Pfizer as the first manufacturer in the United States that was approved with the emergency use authorization. Muskegon County received 1,950 doses through Mercy Health, and the approach will be in phases. Phase 1A is for the frontline healthcare workers, those individuals who will have direct interaction or care for individuals with COVID-19 or suspected of COVID-19. So frontline healthcare workers, then also first responders who may have direct close contact with COVID-19 patients, as well as the residents and workers in long-term care facilities or nursing homes. And that is because that population group has actually experienced and suffered the most critical, severe, and often fatal impact or response of this virus.
So when you say 1,950 doses, does that mean, because this is one that's a two-part one.
Yes.
So that means half of that, which because it doesn't mean 1,950 people, and then there's the second one. Is that for
Right.
2 doses?
So
I'm always confused.
It is Mercy Health, so it's going to be Mercy Health policy to
Right.
manage that, and
Okay.
I believe I don't know that they have decided, but I believe, just to assure, that they have the second dose available
Right.
within that 21-day period or after that 21-day period.
That's what it is. It's a 3-week time.
So for the Pfizer, it's 21 days, and for Moderna, it's 28 days.
Okay. So anyway, it's important to remember when the vaccines are available more widely,
Yes.
widely distributed,
Yes.
2 of them, because
Yes.
it's not really doing you a lot of good to only
Right.
get the
The
one.
first dose will provide some protection, but when you hear about the 95% effectiveness, that is after the second dose.
Okay. So let's talk a little bit more about these vaccines, and I know you're not an expert on all of this numbers,
Right.
but I know that you have experts who work for you. So they do need to get 2 of them to have that high, and that's a pretty highly effective rate.
That
to
is
be at
a
95%.
really impressive rate, yes.
So talk to us a little bit about the speed that these came, because I want to dispel some misunderstandings that are out there, because people are thinking that it's coming so fast that means they took shortcuts on things. So talk to us a little bit about that.
So the COVID-19 virus is coronavirus is a form of SARS, and we have experienced some minor or smaller outbreaks, SARS related, and MERS. So the researchers, the scientists, the vaccine manufacturers have already been researching reaction and vaccinations related to this type of SARS virus. The COVID-19 is the specific virus that they've had to do additional related to that, but research and testing was already underway for a related or a virus in that family.
Okay.
And so that really enabled those researchers and manufacturers to move to step 4 as opposed to like in a 10-step process. Really, they were already complete with most of that. And they actually did go through the normal required processes related to that.
It's just that they started out farther ahead than they
Yes.
normally would.
Yes.
So there's always a concern that you hear in vaccines, because there have been some vaccines that use a live part of the virus or something, that there's a concern that you can get that when you get the vaccine. What can you tell us about that?
So the COVID-19 vaccination is not a live virus. This is a process they refer to as mRNA, which is not a live virus. They have taken, Dr. Justin Grill actually could really describe this much better, but they have really looked at the spikes or the little spores on that virus, and they've used those spores to create this vaccination, which is not the live virus itself.
So the M is kind of like for it mimics that.
Yes,
It's
yes.
the way to
it's sort
remember
of a-
what letter
I don't
we're
want to say
talking
it's
about. Yeah,
artificial, but yes.
It's something that mimics it, and they've been able to create it
Yes.
from that.
And so our blood cells or our bodies will recognize the COVID-19 virus when it's introduced and automatic start building that immunity.
And that's really how a vaccine works,
That
right?
is the normal public health process, even for general natural immunity or vaccine-induced immunity.
Okay. So we know we've got this relatively small amount of doses of the vaccine that are here that are understandably going for first responders and for long-term care facility residents. And I know this isn't up to public health, this is a state thing, but what are you hearing will be the process for rolling that out more widely? What do you anticipate it might be?
Again, in phases, it is up to the state who is deferring to the CDC recommendation, but it will be rolled out in phases, and some of the phases will overlap. So, of course, we are prioritizing as required those individuals who fit phase 1A, but we anticipate in a couple of weeks we will receive another shipment, and we may be able to start phase 1B at the same time as phase 1A is being administered. You know, it changes so much,
Right,
Lisa,
right.
and so I'm always hesitant to
Right,
say.
I'm not trying to put you on the
to say
spot,
this
but-
for sure.
But it's important to say it's phases.
Yes.
So I hear, I think I heard Dr. I'm going to say his name wrong, probably Fauci, the CDC, the head person that we hear about all the time, saying that it probably will be more widely distributed by spring.
Yes. So
April, May, maybe?
so after March or by the end of March and April, the vaccine will be available for healthy adults that didn't fit into any of the other categories. And so we just want to say, it's not here yet, it's not available yet, but be patient, and within a few months, and if 2021, if those months go by any faster than 2020, it'll be before we know it.
Yeah. Who would have thought back in March that it would be a year before we really would start to feel like maybe there's some normalcy
Absolutely.
out there?
I never could have imagined that that this would go on and on and on. Never imagined that.
No, it's been a crazy time with
Yes.
that. It's important then with the holidays coming up to remind people that we're not all vaccinated. We're not
Right.
going to be. This isn't
Absolutely.
going to happen, because even if everybody got their first dose now, we've
we're
got
not
to wait
fully
3 weeks.
protected.
Right. So
And we know that the vaccination will protect the individual who received the vaccination. But we don't know yet if that individual is still able to infect others. So their friends, their family, their coworkers, their loved ones. So even with the vaccination, we ask everyone to continue the safety measures with the mask, the distancing, and the hand washing. There is still so much we don't know. Very, very proud and happy that we have come as far as we have, but we're not
out of the woods yet.
yet, not just yet.
No. And we know that we've seen, what we thought were spikes in April and May were
Oh
nothing
my.
compared to what we saw
Oh
in
my
November.
goodness,
So
yes.
Kathy and Rotary, which I'm a member, shows every week, and we've seen charts that
Yes.
look like big
Wow.
mountains to climb.
And that second surge, it seemed like the virus, so there are 8 strands of this virus that has been identified. And it seems like that the second surge was a more aggressive strand. We had more individuals who were close contacts develop into positive cases. We had, I felt like we had more illnesses, and just amazingly, we all businesses across the board, profit, nonprofit, hospital, Health West, we saw employees. We saw the greatest number of employees that had to be absent due to being positive or a close contact of a positive.
It was very eye-opening for me. I would say in the first few months, I knew one person who had it. She's a long hauler. You know her too, but I'm not going to name her. And then I'd hear about positives. My daughter, who's 19, had some friends, you know, who tested, but there weren't symptoms with them,
Right.
it seemed like.
Right.
So they'd quarantine, do those things they had to.
Yes.
But it seems like in the last 4 to 6 weeks, not 2 days would go by without
Right.
me hearing. And
Oh
I actually
my.
experienced the first death of somebody from,
Yes.
you know, with at least some kind of influence with that. And coworkers and friends and family and a variety of things. And that's what's been so weird about this thing. The symptoms aren't consistent.
They are not. They are not consistent. And so we know the three primary symptoms of that consistent dry cough, the fever, and the shortness of breath. Three primary, but of those secondary symptoms, people experience it sporadically at different levels. So some people have a mild sore throat or a mild cough. Some people lose smell and taste for a long period, some just for a few days. It has impacted and affected different people very differently, sometimes even individuals within the same household.
Right.
So
We've got about 3 minutes left. What final advice would you give to people?
final, my very first thing I would like to say, Lisa, thank you to our residents, our responsible residents and our workers who have tolerated so much and really had to filter through a lot of information. Muskegon County, I am so proud, and I tell so many people, I am so proud that we had established relationships. Like you said, we knew each other. I was already part of Rotary and United Way. And so all of our health and human service organizations, including the hospital, we sat at the table. We were a collaborative body of agencies before COVID. And that really, really helped public health, and me especially, in our response. I have other counterparts in other parts of the state that does not have or did not have the pleasure of knowing. I use like the foundation president by first name. Thank you, Todd Jacobs. Or Cindy Larson, so we all know each other, and we all knew each other, and we worked well together before COVID.
Right.
And so it made our response that much better and that much easier.
Absolutely key. And I think that's that collaboration, and you also chair the Community Coordinating Council, which is a collaborative body of education and government and nonprofits, is really key in everything we're doing in there.
It has been, it's just invaluable. It has absolutely been invaluable to our local public health response. So the final words, of course, continue to stay safe. But thank you so much from the bottom of my heart and everything I have for helping. Everybody has helped in this. Health West, everybody though.
Well, then I'm going to take the last 30 seconds or so that we have to remind people that to find out anything about when vaccinations are out there and when those become available, if you need resources, if you need help with anything, you can always call 211. That's always the big thing we offer. But in the last 30 seconds, I want to also thank you, Kathy Moore, because I know that you have worked many, many unfathomable amounts of hours.
Thank
you. And it's a blessing for our community to have you and your leadership there, and we are grateful to you and your incredible team at Public Health, all of whom have been working remotely and various things. You're in the office, but you're in the office, and that's a sacrifice to your family. So thank you for your family.
Yes,
who
I
is sharing
appreciate
you
that.
as well.
I do appreciate everybody leaning in and making this happen. And I think we are a better community, a safer community because of it.
Absolutely. So our last words: stay safe, stay healthy, wash your hands, wear your mask, and enjoy your holiday season. Let's hope that 2021 is a big improvement over this one with our health. Stay safe, Muskegon County. Thanks for joining us.
Thank you.